We're going to work on Ashley's case today. I'm going to read you Ashley's case and then go through and explain the assignment. Ashley, at age 6.5, could not roll over, sit up, or hold her head up, or use language. Developmentally, she was like an infant. Ashley's parents, who have two other healthy children, had cared for Ashley in their home since birth. Ashley was diagnosed with static encephalopathy, meaning that her brain had stopped developing. Doctors determined that there was no chance of Ashley improving over time. Ashley's parents grew concerned over their abilities to continue to care for Ashley at home. With continued growth and development, she would eventually become too large for them to manage her needs, including feeding her, changing her, bathing her, and positioning her during the night. Additionally, they were concerned at the prospects of her sexual development, including menstruation, breast development, and fertility. Ashley's parents made 3 requests of doctors at Children's Hospital and Regional Medical Center in Seattle. Remember, this is a real case. If you look up Ashley and you look up Seattle Medical, you would be able to find information on her. First, they wanted Ashley to have a hysterectomy, removal of her uterus, to prevent any risk of menstruation or pregnancy. Although there are methods of birth control pills to address these issues, they are accompanied by the possibility of long-term side effects. One risk, blood clots, is considerable in a patient who is bedbound and unable to move herself. Second, they requested the removal of breast buds, which would eliminate the development of breast altogether. Ashley's parents argued that her breasts would cause discomfort and the straps used to hold her in a chair, and that breast discomfort was a known problem for some adult women in the family. There was also a family history of fibrocystic breast disease and breast cancer. Without breast, Ashley would be spared future mammograms and possible biopsies. Finally, Ashley's parents requested medical treatment to limit her final adult height and weight through hormone therapy. High-dose hormone therapy to limit height was common treatment for tall girls in the 1960s and 70s, and the medical risk over the long term are known to be limited. The Ethics Committee noted that there was a great need for caution with such procedures, as there have been many documented cases of past abuses of people with physical and developmental disabilities. Dr. Doug Dykman, who, with Dr. Daniel Gunther, published their paper on Ashley in the Archives of Pediatric and Adolescent Medicine, acted as the ethicist on this case, and as part of the group that determined the outcome of the parents' request. Dr. Dykman noted that there were few medical risks involved with the hysterectomy and removal of breast buds, standard surgical procedural risk, and only slightly higher risk associated with the hormone therapy, such as blood clotting. Critics noted that this combination of surgery and hormones to prevent a person from maturing into an adult was unprecedented in medical history. There were also worries about Ashley's rights as a patient, as her parents were making this decision without her ability to contribute. There was a general debate about the potential slippery slope of adapting the bodies of the disabled to suit the needs of the caregivers, unless it could be justified that this change was also in the patient, Ashley's best interest. An ethics consultation involved about 20 individuals was performed before making the decision. The consultation included a developmental specialist, Ashley's primary care provider, and her hormone specialist. Although Ashley's parents attended the consultation, they were not part of the deliberation. What you are to do now is go through, identify the ethical question. Remember, ethical questions contain should or ought. Should blank happen? What is the ethical question in this case with Ashley? Then what I would like you to do is go through and do what we were doing last week. Consider the principles that apply to this ethical question. Respect for people. Who's involved? What would be, who are the stakeholders, and what considerations do we need to think about for them? Maximizing benefit while minimizing harm. Remember, this is the idea of doing the most amount of good and the least amount of harm. Justice. What is fair? What is fair to each of those stakeholders? And are there any other ethical considerations that we need to identify? Organize some of your information here in this graphic organizer. Then state, what is your position? What would you do? Would you give her the surgery? Would you give her all of the surgeries? Would you not give her certain surgeries? Or would you give her no surgeries? Refer back to those facts that you identified for number 2. Tell me how your position relates to those stakeholders. How is this going to be affected, and how does it support maximizing benefit, respect for people? And are there any other different options that you could do? If you would like to see more information, the last page shows you more information about Ashley. This is an actual picture of Ashley. You can go to these websites that are listed here, and you can find more information on Ashley if you would want to.